All right. So we have something going on today, but first I should insert your name here. This is Bree.
Hello.
So how do we know each other?
So Dr. Orban was my 1250 and 1251 professor up at OSU Marion, and I passed both the classes.
Yeah. So you, and is it safe to say you like physics?
Mm-hmm. Yeah, I like physics. A lot of the stuff that we covered has showed up in almost every single one of my classes following.
There you
so
go.
I'm glad that I paid attention.
And you're not just saying that because I'm sitting here?
Why would I lie?
Okay. What exactly did I say we were going to do today?
Going on a trip, and that's about as far as I know.
We got invited to take a tour of some of the radiation treatment stuff at the OSU Wexner Medical Center, which is part of the James Cancer stuff. So you and I are going to get a tour.
Exciting.
And you all get to watch us on the tour. All right. Next question.
Mm-hmm.
So radiation has been known to develop superpowers in people. There's a possibility that we could develop superpowers.
Yeah.
If so, what superpower are you hoping to?
Obviously time travel.
Time travel? Oh, that's a good one.
Yeah.
That's a
Forward,
good one.
backward. What would yours be?
I mean, reading people's minds would be kind of fun.
Like Edward Cullen in Twilight.
Okay. I'm not as familiar with the Twilight series as you are.
I forgive you.
Okay. All right. Well, we'll like flash up on the screen some Twilight thing.
Make us sparkly.
Yeah. And yeah, I'm excited. Are you excited?
I'm really excited. I've been looking forward to it all week.
Okay. Let's do it.
Yes.
So I forgot to mention, there's a reason why I invited you to come to this thing.
Yeah.
Right? Because we're going to be in a hospital.
Yeah.
And you work in a hospital, right?
I do. I work at Ohio Health Marion General Hospital.
What do you do at the hospital?
So I started out in clinical engineering as an intern, and I worked that for a little over a year. It was an awesome experience. And then I recently became certified as a certified pharmacy tech. So I work as a certified pharmacy technician. During 2021, I did a lot of not necessarily patient focused, but patient device focused. So things like Alaris pumps, anything that goes onto the machines for ventilation or for anesthesia. I got to work a lot into that stuff. So, but because of the pandemic, I wanted to hyper-focus my electrical and robotics experience in engineering and kind of move more towards engineering with medicine.
So you're now studying what?
Biomedical engineering at The Ohio State University.
Yeah. So and you think your experience helping COVID patients played a role in getting to that point?
I definitely think so.
Yeah.
There's a need for innovation in medicine, and engineering is just a fancy word for complex problem solving. So when those two things go together, you get to have a great impact on medicine and patients. So that's definitely seeing COVID and being able to help in the hospital in clinical engineering. It has absolutely motivated me to study BME.
And one of the fascinating things I think is the way that the improvements in technology ultimately improve the patient care.
Oh yeah, and it's even 5-10 years from now, we're going to be in a completely different environment in medicine with just strictly talking about technology. And I'm really excited because it seems like we're going to learn a lot today about that.
Coming soon, all right?
Coming soon.
We're doing this in connection to a group called APS IDEA. APS is the American Physical Society, and they have a group that aims to increase the diversity of folks who go on to study physics.
It's very important.
Our goal today is that, normally when we think about physicists, we think about, me standing in front of a whiteboard all the time, running computer simulations or whatever. We don't often think about hospitals, right?
Yeah.
So we're going to interview today a medical physicist, and she's going to tell us more about what she does.
That's awesome. I'm really excited.
is a linear accelerator. This is what we use to treat the patients. The patients will lie here on the couch, and this machine is able to rotate around the patient to deliver the radiation. It's very long because it needs to accelerate the electrons to a high energy, and then we can treat with either electrons or photons using this machine. You'll see that the radiation will come out here. This is what we call the head of the machine, and that's what will be used to treat the patient. But we have other devices here on the side that are the imaging devices, so we can do x-rays, we can do cone beam CTs, or we can use this imaging panel here on the bottom to image the patient prior to treatment. So this is where it starts. This is where the power will come from for the linear accelerator. Inside, this is a klystron, so this is what is used to amplify the microwaves that are used to accelerate the electrons. So this is inside the back of the machine.
And is there connections to like high energy physics with this sort of stuff? Like was it developed in high energy physics and then it came to the hospitals later, or how did that work?
Sure. So the Varian brothers were the ones that invented the klystron, and that's what made it possible for medical treatments to take place. So you'll see that this company is called Varian, that's named after those brothers. So okay. This is a development that comes from like radar technology.
Okay. Nerd question: How high of energy do the electrons get from that?
From this, the actual energy that you'll get will be based on how long this waveguide is. So based on this klystron here, we can go up to about 20 MeV, okay. So 20 mega electron volts. So we'll start up here. You'll start with your electron source. It'll accelerate down the length of this waveguide here, and the electrons will be bent around using a bending magnet, and then we'll be able to either use that electron beam for treatment or use photons for treatment. All right, so this is the treatment couch. This is what we use for patients to put them in the right position. This couch will extend and we'll put the patient in the exact right position, which is what we call isocenter, which is the center of the beam. So I'm going to turn off the lights for a second, and we'll be able to see the lasers to represent where that's going to be in radiation space. This will represent where isocenter is, so you can see where these lasers intersect will be where that area is. So if we were treating the brain in this case, we would move the patient using the table into position. You can see that right now it's right on his nose, and then we'd be able to align the patient to make sure they're in the right location in all directions. We can turn the light back on. Depending on the patient plan, the gantry would be able to move around the patient. We would image the patient using the imaging arms prior to treatment, and this is an example of how the gantry could rotate around in order to treat the patient. This is where the patient would be set up if we're treating the head, but we can treat any disease site in the body by moving the couch into position, and we can align the patient, and the gantry will be able to rotate around to deliver that radiation. Okay, so this is the console area. This is where the therapist will work to set up the patient, and then everyone's outside the room during the treatment to minimize the dose to personnel. So we can always see and hear the patients at all time. And what I'm gonna do now is set up to image this phantom that's on the table. So we're gonna prepare to image, and then we're gonna move our imaging arms out and rotate the gantry around. So you'll see that this imager, this is an X-ray source, and the imaging panel are now rotating around. And now we're going to start the X-ray beam. So this is the imaging beam, and it's a much lower energy than we'll use for treatment. It is 125 kV, and as it rotates around, this is where the X-rays are coming out of, and this is the imaging panel behind it. We can get a preview of those individual X-rays here as it's rotating around this phantom, and this is what we would see if we were treating a patient as well. So here you'll see the bony anatomy that's the easiest to see on an X-ray. So you can see this vertebral bodies. You can see the hips here. And for this imaging, it takes about a minute for the gantry to rotate around the patient. So we now collected a lot of different x-rays as projections. And now we're going to reconstruct those together so that instead of having a 2D projection, we can have a 3D image set. So this is called computed tomography, or CT. And specifically, this is a cone beam CT. So right now we're using one of our advanced algorithms to make the image look good. So this will take about 1 minute to load. Okay, now that's reconstructed, so we can look at that 3D image set. And now we can scroll through the anatomy and see how the patient looks for that day. So here's your different imaging planes. Here's your axial plane where you can look at the patient anatomy. This is a sagittal and coronal. So the physician and the therapist can work together to make sure that everything is good for that day and make any fine-tune adjustments to the couch to make sure that the patient is aligned prior to treatment.
So what is your official title?
So my name's Ashley Cetnar. I'm an assistant professor in radiation oncology and a medical physicist.
That's awesome. So what is a medical physicist for people who don't know what that is?
So medical physics is a really fun profession. What we do is we tie together the applications of physics and medicine and put those together to help patients. So there's two main fields, radiation oncology or therapy, that we're using radiation to treat patients, and then there's imaging where we can look inside the body and use different imaging techniques. So medical physicists are scientists that help patients, so we're involved in the clinical work. So as patients come into the clinic, we help with clinical procedures, we conduct research, and we teach as well.
So what's like your typical day?
So I would say no 2 days are the same. That's the fun part about the field. But in general, in a clinical medical physics role, supporting patient care. So in radiation therapy, each patient that comes in has a patient-specific plan. So we're part of that treatment planning process to make sure that there's the best plan for each patient. So we're involved in like quality, safety, for making sure that the plans are the best that they can be and can be delivered by the linear accelerator. We also are kind of like pharmacists, that as a physician says, this is the dose that I want to go to the patient, we'll ensure that that dose is actually what comes out of the machines. So those are some of the things that are our responsibilities, but we help support things in the clinic. We help implement new technology, so as new innovations come out, we'll implement those things in the clinic. And again, we're involved in like research and teaching as well.
So are there moments where your knowledge of some physics concept is helping you to do the job, is helping you to solve problems and serve patients?
That's a great question. I would say having a background in physics, like having a physics major, really prepares you to think about the world differently. It helps you to solve problems that are very difficult and apply that knowledge in different situations. So the problem-solving skills that you learn in a physics major, while you may not be solving Maxwell's equations every day, those different things that you learn along the way are really helpful for troubleshooting things, implementing new technology, and being able to solve clinical problems as well.
So how did you get into medical physics? Like, so you did your bachelor's, and then what happened? Like, so how did you get to where you are?
Sure. So I did my undergraduate degree, my bachelor's in physics, and each summer I did research experiences for undergraduates to learn more about what I might want to do, because I wasn't sure as a physics major what I wanted to be whenever I grew up. So each summer learned different things, and things that I wanted to do and things that I didn't want to do. And in between my junior and senior year, I had an opportunity to learn about proton therapy at Hampton University, and fell in love with medical physics and decided that was the profession I wanted to do with my physics major.
Now, proton therapy, do we do that at Ohio State?
We're about to. We're about to treat our first patient in about a week or two. So on West Campus, we now have a proton therapy center that we're able to bring that technology to patients in Central Ohio. So while what you see behind us we'll treat with electrons or photons, protons are heavier particles that can be used for different procedures that we can't do with our traditional linear accelerators.
So going back kind of to the patient care side of things, in each clinical case, how do you decide what's the best therapy for each patient? Like, what does that process kind of look like for you guys?
It's a great question. So we work with a larger clinical team that there's physicians, there's nurses, we have dosimetrists, medical physicists, and therapists that are all really important to the process. So it's a team effort. Ultimately, the physician will diagnose the disease and come up with the treatment that is best, but we'll collaborate together whenever there's different diseases that could be treated different ways on what might be best for the patient. So for example, most of our patients are treated with photons or high energy x-rays, but if you're treating something more superficial, electrons, the way that they interact with matter will deliver a more superficial dose with less what we call exit dose, or dose that would go through the body. So for most patients, they'll get a photon treatment using those high energy x-rays. For more superficial disease, electrons are more common. And then for protons, they have different ways that they interact with the body that we can use what's called the Bragg peak to be able to precisely put that radiation in different locations in the body.
Do you use computer programming in your job at all?
Yeah, so as a medical physicist, having a background knowledge of computer programming is really important to understand not only like the logic and the programmatic thinking to be able to solve problems, but in our treatment planning systems, we use computer simulations in order to understand how that dose is going to affect the body so that we can make the best plans for our patients. And then also with automation, scripting, being able to write computer programs can help advance the technology as well. So we can make our work more streamlined, and then we can innovate to do new things in the future.
Cool. Do you ever worry about being exposed to the radiation?
Personally, I do not. In medical physics, you learn a lot about radiation and radiation safety. So while radiation can be really important for using it to damage cells, if you use it appropriately, it can be very safe. So we have like health safety, radiation safety courses to understand how that works. So if you use radiation wisely, it can be very beneficial for patients and still be safe for employees. You'll see now that if you're a radiation worker, you're badged, so you have different dosimeters that'll track your dose over time as well. So that's one way of quantifying the radiation.
Great.
All right, so as a woman in science and technology, I know it's very underrepresented that we see fellow females. What is something that you wish you could go back and tell your past self, your younger self, a piece of advice?
I think it's a good question. Looking back, I would say to find other people to collaborate with, work with, so that you don't have to do it alone. But I've been fortunate to have a lot of great male colleagues and female colleagues along the way. But to find other people to work together with so that you don't feel alone, I would say was most important, especially with the statistics as like a physics major and things like that, that statistically it's unlikely that you might have another female in your classes. To find other people as well would be a recommendation that I'd give myself.
Yeah, I definitely see that, having people in your corner and on your team who are constantly there to like support you and celebrate your wins, but be there for your losses, and you know, maybe they can help you solve some super hard problem that you got going on, just thinking about it in a different way. That's really good advice.
And I would also say is to be that advocate and supportive of other people as well. And while you may not have had that role model, you can always be that role model for others as well. So reaching out to other people in the field to help them along the way is helpful.
So if someone's interested to study medical physics, like what's the next steps for them? How would they study to get to where you are?
So in order to be a medical physicist, you'll have usually a an undergraduate degree in physics or a closely related field, so at least a minor in physics as background information. And then you'll go to graduate school to learn more about medical physics. So you can either pursue a master's degree or a PhD to learn more about the field, be able to gain the knowledge and skills to be successful. And then after that, there's a 2-year clinical residency. So you'll spend 2 years in the clinic learning how to do the job of a medical physicist, and then you can move on to be a board certified medical physicist.
What's the best part of your job?
I think that there's so many great parts of my job that I really am blessed to have the opportunity to do something that I love every day. But I think that it's the instant gratification of knowing that you help people every day by what you do is one of the most attractive aspects. I know in other areas of physics research, it might be months or years or more before you feel that there's some type of like satisfaction that the work that you're doing is important, and that's something that you can have every day in the field of medical physics.
Now, you have a project to work with high school physics teachers. Can you tell us more about that?
Sure. We were awarded a grant earlier this year in order to collaborate with with physics teachers and science teachers in Central Ohio. So there were 10 people that were selected for this program, and it's a pairing between a physics teacher and a biology teacher that they're collaborating with us to learn about medical physics. So they came on site to have some training to learn about the field, and then they're taking that information back into the classroom to share about medical physics. So throughout this semester in the fall, they've been teaching their students, and we're looking forward to in the future, in the spring, we're hosting a medical physics day for students to come on site to learn more about medical physics, how that's applied, to see things in real life, and then having a follow-up symposium for other science teachers in the area so that they can learn about that as well.
Well, we appreciate you letting us have the tour and showing us all this stuff and learning more about what you do.
Thank you very much for having me. It's a pleasure, and if anyone needs anything, feel free to reach out.
All right, thanks.
Thank you.